Through our special reports surrounding COVID-19 on the border, we've learned how hard our border communities have been hit by the virus. Also looked into what factors play a role in the spike in cases. And in our final installment of this series, Alison Rodriguez looks at what's being done to try and slow the spread and keep communities safe.
The amount of patient encounter has increased significantly.
Dr. Eladio Pereira works at the Mariposa Community Health Center down in Nogales. They have been going nonstop.
It has been like we've never seen before. The number of patients with active disease has increased dramatically.
The main campus is screening patients before they can even come in the building.
It's gonna be in the ear, okay, and I'm gonna give you some Germans, okay?
Everyone has to do it, no exceptions.
Since the first week in March, we decided to make some changes that were very significant, from surgical masking use to procedures to keep our staff safe, implementation of our screening stations.
The health crisis has put a strain not only on them, but all health resources around the state.
Certainly in rural areas like ours, that's magnified because the choices are not the same.
He's worried older patients, the most vulnerable to COVID, won't seek help because they're not familiar with telemedicine, they don't have transportation to the clinic, or because they're frightened.
We're a little concerned that sometimes they don't come to see us because they're concerned about COVID, and certainly rightfully so. But we need to keep in the back of our mind that those patients still need to see us. But they have huge challenges as well.
According to the Arizona Department of Health Services website, people 65 and older make up 75% of deaths across the state. So medical professionals are stressing the importance of things they say we all know to do by now.
My advice to my patients are continue social distancing. I would prefer if there was still a stay-at-home order in place, but since there's not, social distancing has to be our major way of keeping ourselves healthy.
I asked the governor for the exact ways he'd address the issues at our border counties. His office sent me a statement saying they were tracking data along the border and had plans to expand public health education. Though when I asked for specifics, I didn't get any. They also say they're going to ramp up testing, something desperately in short supply in these areas.
Well, we would like to see increased testing down here. We have increased our testing quite a bit. Unfortunately, we were slow to get that testing down here.
Jeff Terrell is the Santa Cruz County Health Director. He says the county is trying to put on testing blitzes, but they need help.
We are trying to work with the state as far as getting some funding, additional funding, to set up some blitzes so we can get that additional testing to hopefully get most of the citizens of Santa Cruz County tested.
Another thing they believe will help Santa Cruz and Yuma counties are masks, especially if you're working in tight groups. The #1 industry here in Yuma County is agriculture, and the farm workers who tend to this land often work closely together, leaving little room for social distancing. There's been a COVID outbreak on farms in some Canadian provinces. 3 people have died. All 3 patients were workers from Mexico, and procedures are being looked at to keep them safe.
It spikes so much.
Nogales Mayor Arturo Garino wanted masks mandatory in his city before Governor Doug Ducey gave the go-ahead.
We're going to have to make sure that this is enforced citywide and countywide. And the way I think it should be done, if that's the case when it comes to a mask, it has to be enforced statewide. Because if you have people coming in from Tucson or coming in from Nogales, Sonora, they better understand that they need to wear a mask when they go into a store.
Patients are
CEO of Sunset Health Clinic in Yuma County, David Rogers, agrees masks will be highly effective in slowing the spread.
You know, with the rate of infection and with the surge that's going on, I certainly do not understand why people aren't wearing a mask, because with this type of a virus, it's absolutely the best way to protect yourself is to distance at least 6 feet and to wear a mask.
They are mandatory in certain cities and counties in Arizona, but not statewide, and there's still debate on enforcement. All but one person I spoke to told me they don't believe the state should have a second lockdown. But these medical professionals do all agree washing hands, wearing masks, and social distancing are all anyone can do until this virus is under control.
Well, there's no cure, there's no vaccine, so there's nothing we can immediately do to make this go away. All we can do are the preventive measures like keeping distancing, hands, protective equipment. All those things are things we can do now but that's, again, not an immediate fix of the problem.
This has been a special look at COVID on the border. Reporting for ABC 15 Arizona, I'm Allison Rodriguez.